So this is about the, so we're done with this thing guys, parasympathetic, deep cervical fascia, dural venous sinuses, muscles, and the about a little about the triangle. So now let's come to the neuro part, the neuroanatomy here. Well, no paper can go by without having a question from neuroanatomy. We do have sometime the paper which are missing the questions from the upper limb or lower limb or maybe thorax or sometime pelvis. Some part may be missing because of, but I don't think there is any paper ever in which you don't have a question from neuroanatomy. There has to be a question from neuro part here. So that's the sequence we're going to go in this, guys. We'll talk about the brain, spinal cord tracts. We'll talk about the brainstem. Then we'll talk about the syndromes, different syndromes. In the cerebellum, we'll be particular about the cortex and the peduncles here. And during the white matter, we'll talk about the different sections and finally the thalamic connections here. So, and I presume that majority of your questions which are asked in the exam will be covered in that part. So, without a further ado, let's start with the neuro here. Okay, so guys, let's start the neuroanatomy here, and in the neuroanatomy, we'll begin with the spinal cord here. So first, the two sections which I'll show you here, one which will show the main ascending tracts and their function, and the descending tract and their function, and then we'll only trace the major tracts one by one. So this picture here is to tell us about the ascending tracts. Now the ascending tract which are marked in this picture here, what you can see that in the dorsal column, guys, where I'm pointing out, that's a dorsal column tract, and there are two components of the dorsal column tract. One is called as the fasciculus gracilis. This is fasciculus gracilis, and this here is fasciculus cuneatus. Fasciculus gracilis and fasciculus cuneatus. Both these are the dorsal column tract. They are the combination of the dorsal column tract. Together they are dorsal column tract. Now guys, fasciculus gracilis are the fibers which are coming from lower limb, and fasciculus cuneatus are the fibers which are coming from upper limb. That's the difference. The gracilis are from the lower limb and cuneatus are coming from the upper limb here. And the function of this tract, whether it is fasciculus gracilis or fasciculus cuneatus, the function of the dorsal column tract is to carry, number one, conscious proprioception. Number one. Number two, it does carry fine touch, vibration, stereognosis, to some extent pressure also, but the conscious proprioception, fine touch, vibration, stereognosis, that's the function of the dorsal column tract. That's the main thing which are carried by the dorsal column tract. As I said, to some extent pressure also. Then you can see these two tracts which are present toward the lateral side of spinal cord. Very much in the lateral side of the spinal cord, we have the spinocerebellar tract. This is dorsal spinocerebellar. That is dorsal spinocerebellar tract. And this one here is the ventral, guys. That is the ventral spinocerebellar tract. Dorsal and ventral spinocerebellar tract. And both the dorsal and ventral spinocerebellar tract, they are responsible for the unconscious proprioception. They are responsible for the unconscious proprioception. So just keep an eye, guys, that conscious proprioception is a function of the dorsal column tract, and unconscious proprioception, the one that you don't know about, like when you walk, you just sway your hand. Your one hand goes in front, one hand goes behind, and this keeps happening in a coordinated manner. That's a function of cerebellum basically. So unconscious proprioception, the proprioception which your cerebellum is not aware of, is going into the cerebellum here. That's unconscious into the cerebellum. That's spinocerebellar tract. And then the two another important major tract, one toward the lateral side and one toward the anterior side of spinal cord. And that's how they're named also. This is lateral, this is anterior. Lateral what? Lateral spinothalamic tract. Guys, this tract here is a lateral spinothalamic tract, and this one here is an anterior spinothalamic tract. the lateral spinothalamic and anterior spinothalamic tract. Well, lateral spinothalamic tract function is to carry pain and temperature. It's a very important tract. It's a tract clinically very important, guys. Pain and temperature from the body, not from the face. Face ke liye to we have trigeminal nerve. Below the face, everything, the pain and temperature is carried by the lateral spinothalamic tract. And anterior spinothalamic tract is responsible for the crude touch and pressure. It is for the crude touch and pressure. So both the spinothalamic tract collectively, I can say, is for pain, temperature, crude touch and pressure. More precisely, lateral is for pain and temperature, and anterior spinothalamic tract is for crude touch and pressure. Now we will be discussing all these tracts in more detail after this. But the first thing that you should know, that what is the location of the tract, because again, if it is an image based question, any syndrome of the spinal cord, they will say, like if they say Tabes dorsalis, guys, Tabes dorsalis, obviously what part is gone? This portion is gone. So dorsal column tract is involved. If it is a case of poliomyelitis, your dorsal horn will be involved. If it is a case of the let's say Brown Sequard syndrome, the entire half of spinal cord will be involved here. So it could be an image based question. So you should know what is the location of the tract. Although you know the function of all these tracts, but their relative location in the spinal cord is also important. What is dorsal? What is toward the lateral side? What is toward the anterior side? Where these tracts are present. That's ascending tract, guys. That is the ascending tract, location and function. Descending tract. Now the next picture which I'll show you is just to show the major descending tracts here. In this image, in this transverse section of spinal cord, the main descending tracts are seen. The main descending tracts are seen. Well, we all know the most important descending tract, the one which we'll also focus mainly on, is a pyramidal tract, guys. Pyramidal tract, also called as a corticospinal tract. The pyramidal or corticospinal tract. We call it pyramidal tract or corticospinal tract. Well, the reason for calling it corticospinal, because it is coming from the cortex to the spinal cord, that's corticospinal. There are two parts of corticospinal tract or pyramidal tract. One which is present very much in the anterior part of spinal cord, let me label it here only, and one in the lateral part of the spinal cord. So one in the anterior portion and one in the lateral portion of the spinal cord. This one in the anterior side is called as anterior corticospinal tract. That is anterior corticospinal, and the one toward the lateral side is the lateral corticospinal. Anterior corticospinal and lateral corticospinal tract. Both are the components of pyramidal tract only. Guys, anterior corticospinal tract are those fibers which are uncrossed. They did not cross, they just come straight down. And those fibers which are crossed in the brainstem and then comes downward, they are lateral corticospinal tract. I will explain them with the help of a diagram, but as of now, remember, the crossed one is lateral corticospinal, uncrossed is anterior corticospinal. But is that the only difference? No, there is another difference also. The another difference is anterior corticospinal tract is basically for limbs. It is basically for axial muscle. I'm sorry, it is not for limbs, it is for axial muscles. Whereas lateral corticospinal tract is for limb muscle. It supplies the upper limb and lower limb muscles. It's easy to remember, guys. A for anterior, A for axial muscle. L for lateral, L for limb muscles. So anterior corticospinal tract for axial muscles, intercostal, abdominal muscle. Whereas lateral corticospinal tract is supplying the limb muscles, upper limb, lower limb. All the muscles are supplied by the lateral corticospinal tract. Well, what is the function? The function of this tract, whether anterior or lateral corticospinal tract, the function is the voluntary movement, guys. The skilled voluntary movement is the function. Skilled voluntary movement, or simply you can say voluntary movement is a function of pyramidal tract or corticospinal tract. You all know that. Now, there is another tract which is present very, very close to the lateral corticospinal tract in the lateral side of the spinal cord, and that is coming from the red nucleus, guys. This is called as a rubrospinal tract. Coming from the red nucleus, so we call it rubrospinal. And before I tell you the function of the rubrospinal tract, you should look at this tract also present in the anterior side of spinal cord, coming from the vestibular nuclei. We call it vestibulospinal tract. Rubrospinal tract and vestibulospinal tract here. The reason I want to tell you about them together here, although one is in the lateral side, one is in the anterior side, One is coming from red nucleus, one is coming from vestibular nucleus. Looks completely different location where they're coming from. But see, what is there? Rubrospinal tract is responsible for facilitating flexors. It helps the flexors. It facilitates the flexors here, and at the same time, it inhibit extensors. It facilitates flexors but inhibit extensors. Vestibulospinal tract is exactly opposite. Vestibulospinal tract basically facilitate extensors. It facilitate extensors and it inhibit flexors. So these two tracts, they go hand in hand. And why I'm saying they go hand in hand, see, aisa nahi hai ki you just need one tract and other tract is not required. Both these tracts, they work simultaneously. If I bend forward and pick up something from the floor, so I'm using my flexors right now. So I'm using my rubrospinal tract, which is facilitating the flexors and inhibiting extensor. Fine, I'm bending forward. But imagine if all my extensors are inhibited, then I will not only bend forward, I will fall forward. How can you have a controlled bending, guys? Controlled bending can be done when you have your extensors also working. So the extensors are stimulated or facilitated by which tract? Vestibulospinal tract. So when you're doing some function, your rubrospinal tract is obviously helping you. But vestibulospinal tract is stimulating some particular extensors on your back and helping you maintain your posture. Your posture is while doing any function, responsibility of your posture is a function of vestibulospinal tract here. That's why the name is vestibulospinal. It is related to the vestibular apparatus, vestibular nuclei. So it will just check the body orientation in the space and accordingly it will stimulate the extensor muscle, and that's how we can help to maintain the different postures that is. So vestibulospinal tract is to maintain the posture. Now there's another tract which I've shown here, present in the anterior part of the spinal cord between the anterior corticospinal and vestibulospinal, and this tract is called as a tectospinal tract. Tectospinal tract.